Good evening. Thank you for joining us. Have you ever heard of the ICT Street Team? It's a group of people, volunteers who are doctors, nurses, NPs, many others who offer care to people who live on the streets of Wichita. KIC's Carolina Luera talked with the group today about their future. And Carolina, what did they tell you?
Well, Chris, the group says many people would be affected if they were to shut down. This year alone, they're seeing a 66% increase in patients and the cost of medication skyrocketing.
I love you guys. You guys are the best.
I don't even want to think about what would happen if we weren't here. People would die.
Every week, the ICT Street Team packs their gear and heads to the streets. The nonprofit provides primary care to the homeless in Wichita, like Jewel, who visits the team every Tuesday.
I'm homeless. I'm living under the Johnny Mac Bridge with my sister and my brother and some family.
We travel to encampments and to shelters, just areas where they congregate and where we can reach a large number of people.
Many volunteers come from the medical field, including physician assistants, nurse practitioners, and even medical students. Together, they run weekly street clinics, providing medications, labs, imaging, and other resources to people in need.
People rely on us to be at our clinics every week. They rely on their medications. They rely on us to keep them healthy, out of the hospital, and alive.
I was getting some medication. I've got an ear infection and I've been sick for the past couple of days.
And right now, they are seeing an increase of patients, up 60%.
A busy night used to be probably around 20 or so, and now we've been seeing upwards of 40 patients a night on Thursday clinics. And that's great because we're meeting their needs.
But with a 30% cut in state funding and a 150% price increase in medications, the group says it's now at risk of shutting down.
If we were not on the streets providing services, they would have an increase in additional visits to the emergency rooms, a lot more patients being admitted for illnesses and things that could be controlled by our team.
Organizers say the need for care is even more vital now as we approach colder months.
If it's snowing, if it's a blizzard, we are there. Just in the event that one person shows up, it's worth it to us. If nobody shows up, it's also worth it to us because that means that they're hunkered down somewhere safe, staying warm.
The group says they're accepting donations, whether it's money, unopened medications, or warm clothes for the winter. They're also always looking for volunteers. We'll have a link to how you can help on this story at KIC.com. In studio, Carolina Loera, KIC News on your side.